Natalie Jones. I am a clinical nurse educator at Robert Wood Johnson University Hospital in Hamilton, part of the Robert Wood Johnson Barnabas system. So what I do is in the intensive care unit, in which I'm the clinical nurse educator, I help the team get organized when we do interdisciplinary rounds, where we focus on the patient as the center of care. And we created what is known as the Lotus initiative. Lotus, which is an acronym for leadership, organization, transformation, unity, and sustainability. But it's also a beautiful flower that grows out of muddy, murky soil, which we label as healthcare. And as this lotus grows, we are those petals of healthcare. We're nursing, we're pharmacy, we're the physicians, we're dietitians, and right in the middle of all of those petals is the patient, and we're focused on value-based and patient-centered care. What we found was there's a lot of patients that are coming back to the ICU and to the hospitals because of certain things that aren't being addressed, and we found that was social determinants of health, where we found that we had patients that were suffering from diabetes or congestive health, heart failure, kidney diseases, and they were being labeled as non-compliant because of why they were coming in and being readmitted. But what we found was perhaps it was lack of access to transportation or insurance, or they didn't have food. Perhaps they used their funds to buy food instead of their medications. So we really wanted to get to the root of what was going on, and through this multidisciplinary team, patient-centered approach, that's what we've been doing. Definitely takes a multidisciplinary approach, or as the saying goes, it takes a village. We have different teams that come in and we work together to address different issues that pertain to the patient. So we have the clinical pharmacist that looks at the patient's medications. We have the dietitian that looks at their healthcare needs. Maybe they need to be on a specific diet and they don't understand what that entails. We have the primary nurses that are right there at the bedside that are caring for them and that are taking that extra step to find out what they need. And not only connecting with the patient, but with the families too, because the families are really part of that healthcare as well. So it's very much a multidisciplinary approach. So when I started my role, we were going through a culture change in the hospital, where it was very physician-driven. Nurses were almost cowering to speak up and to physicians and advocate for their patients. And then we had this redesign of our intensivist care team. I have to give credit to Dr. Carol Ash, who was head of our intensivist program, who was very much a motivator and a transformational leader in getting us to speak up and not be afraid to ask questions and advocate for our patients. And by raising the nurses up, we weren't afraid to speak up and advocate for our patients and get what they needed. I think it's definitely prospered. I mean, we're flourishing in our environment. Nurses are encouraging each other and building each other up. We've also been more focused on evidence-based research and looking for better outcomes and better avenues to best serve our patients. My desire for healthcare is that we work together as a team, hand by hand, not having labels like you're a physician, you're a nurse, you're a housekeeper. We're all in it together. We all have one purpose: to serve the patient and their family so that they can get the best care possible. Keep everything alive, keep advocating for your patients, and keep doing what's right. Actually, I was looking for avenues to present my research on the Lotus initiative, and I wanted to share it with anybody who comes through and to network and hopefully gain a better perspective from other patient advocacy groups that are out there.